for this year in the series. And we've called our webinar The Social Determinants of Health and Disability. And we would like to focus today on insights and implications for global health in Africa. And before we go in, I just want to make a few acknowledgements. First of all, huge thanks to Professor Taryn Young, who unfortunately can't be with us, but in whose department and by whose invitation we are able to have this opportunity to present our webinar. And then to Chanel Windvogel, who has been an incredible help to set up the webinar and is here with us also to hold us as we venture on this, in a way, scary way of presenting a seminar. And then to our four presenters, I want to just welcome my colleagues. Professor Kubelam G, who is the Director of the Center for Disability and Rehabilitation Studies, and she will be presenting a case study of Indigenous knowledge ignored. Then we also welcome Dr. Serona Fesahi, who is also a Senior Lecturer in our Center for Disability and Rehabilitation Studies, and Serona will be speaking to the topic of access to assistive products as a social determinant of health. Then we have Mr. Lupiwo Mduzana, all the way from Walter Sisulu University, who's the acting head of the Department of Rehabilitation Medicine there. And he'll follow on from Serona's topic and present to the topic of prosthetics in Southern Africa. And then we have Mr. Mashudu Mpohoni from Sefako Makgato University. He's a lecturer in the Department of Occupational Therapy there, and he will be speaking about education as a social determinant of health. And I just want to do a brief introduction because some attendants might not be familiar with the way that we look at disability as not just an impairment, but we have adopted the World Health Organization's International Classification of Functioning Disability and Health. The reference is there on the screen, and they have defined disability, the complex concept of disability, as an umbrella term for impairments, activity limitations, and participation restrictions, denoting the negative aspects of the interaction between an individual with the health condition and the individual's contextual, that is, environmental and personal factors. So disability is neither simply a biological nor a social phenomenon. And so in this diagram, which summarizes the ICF, which is the abbreviation of the International Classification of Functioning Disability and Health, we can see that a lot depends on the relationships between the various entities. And so that is what we're concentrating on today, is the interaction between the environmental factors, the personal factors, and the bodily functions, activity and participation, and how that affects one another, and specifically the social determinants of health. And there I'd like to come to this diagram, which puts it in a nutshell for us and puts it very clearly in terms of the snapshot areas that we want to consider this afternoon. So again, the focus is here on the arrows, the interrelations between various variables. So the 5 elements of social determinants of health have been described as health and health care, as economic stability. So for instance, in a country where, like for instance Zimbabwe, where there's a lot of instability economically, or here in South Africa, as a matter of fact, that would be a very strong determinant of health. Education is a determinant of a social determinant of health, and we'll hear more about that from Mashudu. Then neighborhood and the built environment. We will also, all of our topics this afternoon are interrelating and overlapping, but for this one I specifically want to point your attention to what Professor MG will be presenting, and then social and community context again is an overlap of various ones, and some of our topics this afternoon will be addressing that. And then I just wanted to also say the whole area of assistive technology, to which we are giving quite a lot of time and attention in this presentation this afternoon. Both Serona and Lupiwo will be giving presentations on that. Just the difference that assistive devices or assistive technologies make, not only to the existing condition, but to additional conditions. And so without further ado, I want to hand over to Professor MG, who will be doing the first presentation, a case study of Indigenous knowledge ignored. And with that, over to Gubela.